County governments have been urged to increase investments in health services to curb preventable maternal and newborn deaths as current efforts remain insufficient to meet the 2030 Sustainable Development Goals now.
Once known as the world's fastest woman, Bowie died from complications of childbirth.
Limited access to quality and affordable maternal health care has worsened the crisis.
Statistics show that Kenya loses about 5,000 women and 92 infants to preventable complications.
Where health stakeholders are calling for urgent action to curb rising maternal deaths attributed to postpartum hemorrhage, that is PPH.
It's a big deal for us because sometimes we are losing 5 mothers, 10 mothers a month.
What?
Sometimes we're losing 3, sometimes we're losing 2.
There is a group that has come together and they want to sensitize matters around it and people around it.
In 1985, we had mothers dying from childbirth-related and pregnancy-related causes. We lose most of these women due to bleeding in pregnancy. We also lose them because of high blood pressure. We lose them because they have sepsis or infection during delivery. And we lose these babies when they are born too small because of the conditions in the mother.
We've had indicators showing that we are not doing very well in terms of maternal health.
Giving birth should not be a death sentence. Bleeding a life should not be the end of another life.
It's not acceptable to have a maternal mortality ratio of 355 per 100,000 and a newborn mortality of 22 per 1,000 live births. We need to be accountable for the deaths of our mothers and our newborns. They are not dying because we are unable to treat them. They are dying because we have not made that decision.
When a mother leaves home to go to the hospital is one of the situations, not just in Kenya but in the world, where we are celebrating as they go to the hospital. Because they're not going to the hospital because they're sick. They are going because we are expecting blessings. And therefore, back at home, people are usually preparing for a celebration. So you can imagine how they feel when a wedding becomes a funeral. Because that is the situation we are faced with here.
We look at ways to lower or curb, have 0 deaths during childbearing.
It's actually a very powerful demonstration when healthcare workers actually come together to see how they can mobilize each other, regardless of where they come from, to basically contribute to the bad figures within the country. We all know that the maternal health indicators and the newborn indicators are not very good, but through many other initiatives, I think we can be able to address it. Not everything would require heavy resources. There are things that basically require soft interventions to prevent maternal death.
Health is a devolved function, and counties have taken these matters of maternal mortality and child mortality seriously. A lot of work has been done over the years, but now we need to accelerate these gains. This is the first seriously county-led initiative in terms of health.
One of the key pillars that advance social aspects and growth of a country is actually the health component. Under the Kenyan Constitution, health is a fully devolved function. And as a Council of Governors, if there's anything else that we take seriously, is to ensure that the health function works across all the 47 counties. And one of those projects or programs is actually the MPDSR, Maternal and Prenatal Death Surveillance and Response.
Dealing with this, we have to do sensitization, we have to take the lead. As county governments, we have to change the story and contribute to the national numbers, reducing them and ensuring that we are not losing any mother to anything preventable in terms of maternal and child health.
We have put measures in prevention, such as one, we managed to develop a maternal shelters in our health facilities, where mothers at risk can come stay in the facility until they deliver, and if need be, they can be referred as early as possible. We have also intensified our outreaches and also create awareness to make sure that our mothers attend the antenatal clinic. Mothers at risk are identified early and referred to the county referral hospital.
We have had plans of drug supply up to the last mile dispensaries so that it can be accessible. And so far so good, we are doing so well because of on the part of supplies. and also the services to the other county levels. Also, the county government has taken an initiative of reviving the closed dispensaries, which were not operational, whereby the services are taken closer to our communities. Not only having the structures, but also giving the services in that particular centers. That is what is important for us as a county. There are counties that are actually reporting zero maternal death for some months. Right now, we have an example like Kiambu County, which is now recording 7 months of zero maternal death. We have Garissa, which is recording 3 months of zero maternal death. We have Machakos, which is recording zero maternal death for the last 3 months. Homa Bay now going into their 4th month. And these are good stories that basically we want to hear.
We've come a long way, and we want to bring the numbers to zero, so that every child should see a life after this.
We have just deployed 111 nurses to various health facilities that were not operational before. This is going also to increase that access to skilled healthcare delivery, and in a way it's also going to reduce maternal deaths. And in this financial year budget, we have budgeted for over 100 million that will go to health facilities, mainly to help in referrals.
We have operationalized over 6 new maternities in the past 2.5 years, and we are on course to establish about 4 more this financial year. This is to make sure that there is accessibility to skilled birth attendants in the process of birth by our pregnant mothers.
We actually pride ourselves because this has become a reality and gains that all of us are celebrating as the devolution family. We have counties that have gone over 7 months without a single death. And one of our mantra is to ensure that this is replicated in all the 47 counties, so that we guarantee the future in terms of lively existence and ensuring that each and every child that is born, a mother does not lose life while giving birth.
I want to agree no more that these initiatives should be supported, so that we learn from the counties that have moved higher, like Kiambu County, having significantly reduced the maternal mortality to 0 cases in the first 7 months of the year. And also we look at Homa Bay. In the last 100 days, they've not had a maternal mortality. What are these things that have been done? It's only doing things differently.
We are actually committing ourselves to ensure that we really do something about these deaths that occur. First of all, the main issue would be to do the surveillance. When deaths occur, we want to learn from them and possibly reduce them from occurring once again.
I, as a foot soldier, saw the need, and we had grown wary of overseeing mortality of newborns and mothers, and we sought audience, we sought an opportunity to come and share our stories. We are very grateful that with this CEC caucus we feel heard, we have engaged very fruitfully, and we have commitment from our leaders that we are going to change the numbers.
Can we ensure that the last part of the MPDSR, that is R, the response part of it is respected, is honored, and is budgeted for? Why am I saying this? If the response component of it is not given attention, then we'll be doing the same things year in, year out.
As a national government, it is our top priority. We cannot accept this position where we are, and our leadership is in sync, providing the required resources and leadership, and we want also the county government to really pick up this piece with us, so that we have a shared vision of making maternal mortality a thing of the past in this nation.
The maternal mortalities can be stopped, and indeed it's my clarion call that as a country we need to look at the deaths of mothers and deaths of children or infants as abnormal, and it should prick our conscience, and indeed we need to act with speed.
My call is, for the unfortunate events, let's review, learn. And this review has to go beyond just the healthcare worker. Community, family to the community, to the healthcare facility, to the political leadership, being able to identify and commit by responding to the challenges that have been addressed or identified to get a solution.
Childbearing should not be issues for losing life.
Moving forward is also to thank the Inter-County MPDSR team for the kind of work that they are doing, bringing us a very uncostly method for us to try and reduce maternal and perinatal deaths within our facilities or within our counties.
I want to really appreciate the steps that has been taken by the Inter-County MPDSR team and the initiative that we have taken this time to really fully support us CCMs for health.
I am very happy that we have this MPDSR that has been started in 16 counties. I'm happy that the units are working. Any county that does not have this do not have the basics to human rights, and we will ensure that all the counties get.
We want to commit that we will rally beyond all our people to ensure that we eliminate home deliveries, ensure that we have antenatal visits, the ones that are recommended by WHO, and we will have, most importantly, we will have the right medication, the right equipment, the right personnel, and also ensure that the training is the one that is needed for this to end. We will ensure that that is provided.
We promise to work together with them as frontline health workers. We are your soldiers. We want to be held accountable, and we also want to hold you accountable as our leaders to see what we all need to do, because most of what needs to be done is actually the soft interventions. We have seen counties and facilities that are now reporting 0 maternal deaths, and all of it is from soft interventions. So we are so grateful, and we look forward to continuing working together with the Ministry of Health, with the Council of Governors, to make sure that every pregnancy is safe and every newborn does not just survive, but they actually thrive.
Every woman and every newborn, everywhere, must survive and thrive.
Our agenda is to make every child alive.
The mothers must celebrate the fruits of their wombs.
We as Council of Governors are committed to basically support the process, and moving forward, we want to contribute to the figures of this country. No mother should basically die as a result of giving birth.
If it is doable anywhere in the world, we also have what it takes to be in that single digit.
One of the key mantras that we said as a Council of Governors is we affirm that every woman, every newborn, everywhere should not only survive, but thrive. We boldly commit to working with all the 47 counties to achieve 0 preventable maternal deaths in Kenya. And this is my commitment as the CEO of the Council of Governors.